Our two speakers today are from the University of Washington. We have Dr. Christine Loftus, who is the Clinical Associate Professor in the Department of Environmental and Occupational Health Sciences. She is an environmental epidemiologist who has been conducting research about the impact of air pollution and wildfire smoke on child health. Javier Silva is a UW PhD student in epidemiology and grew up in the Yakima Valley, where I believe this research took place. Welcome, Dr. Loftus and Javier. We're looking forward to your presentation, and I'm going to go ahead and stop sharing my screen so that you can share your slides.
Thank you so much, Carolyn, for the introduction and for this opportunity. We've been really looking forward to being able to share our research with the group. Let's see. All right. So how do the slides look? Is this the right setup?
It
Yes, we
looks
see
good.
your slides.
Great, thank you. And so, yes, as Carolyn said, I'm an environmental epidemiologist. I've spent a lot of my career trying to understand the way that the chemical environment that children grow up in, including in the prenatal period, how that affects their health and development. And more recently in my research, I've been shifting towards figuring out ways to protect children from the chemical environment. And so strategies, programs for mitigating the health effects of the chemical environment on children. And that's largely what we're going to be talking about today in terms of wildfire smoke. And let me So our talk today is going to have three parts. I'll get us started by talking about the public health problem of wildfire smoke and child health. And before I get too much further, especially using this photo, I'd like to note that for this presentation, our focus is on the health hazards posed by exposure to smoke from wildfires. There's many communities who are exposed directly to the wildfires themselves. For example, just last winter in 2025, there were the fires in Los Angeles that had devastating impacts on the physical and the psychological health and well-being of both children and their families. And so while those are very significant public health dangers of the fires themselves, this talk is focused on wildfire smoke, which affects more people in the US and worldwide than the fires themselves, because the smoke can travel hundreds of miles across continents even from the point of the fires. And fire smoke itself causes significant adverse effects on health, even at very low levels. And I'll talk more about that in a couple minutes. So part one is an overview of this public health problem and a focus on the current gaps in the scientific knowledge that our team is trying to address in our current research. Then I'll hand over to Javier. He's going to describe a very specific study that was conducted in Washington State. And then finally, I'll talk about how we're building on that project for new and future research. Let's see. And so I know we have attendees here from across the United States. And so, as many of you know, as you've experienced yourselves, wildfire smoke has been increasing over recent decades. And this is due to warmer, drier climate, which is increasing wildfire activity, both in North America and worldwide. And with fires, there's been an increase in dangerous episodes of extreme wildfire smoke. So in the past, smoke events were mostly limited to the Western United States. Then in 2023 was remarkable in the sense that there were a series of large fires in Canada that resulted in smoke that blanketed much of the Midwest and the northeastern United States, bringing surreal images such as these, for example. And so we have soybean fields in the Midwest, the New York City skyline blanketed under thick smoke for several days during that summer. And so this 2023 episode, this was referred to as historic and unprecedented. And though the same thing happened just this past summer. And so, as early as the start of June, which is very early for wildfire smoke season in general, and then again in late July and August, smoke covered vast portions of the United States, exposing millions of people to unhealthy levels of wildfires, of air pollution. And so this map was created by a research group as this past summer we tracked the progression of wildfire smoke, and we track the number of people exposed and impacts on child health across the summer. So the gray areas represent regions where heavy smoke plumes were visible by satellite. And then the orange and red dots indicate where ground level air pollution was being monitored and reached very unhealthy levels. And so this is on one day in July 30th, but these exposures span several days throughout the summer. And we know that this problem is going to grow in future decades. Recent predictions about the trend in wildfire activity and smoke suggest that by 2050, summers and fall seasons like this will become the new normal. And the wildfire smoke exposure will cause approximately 70,000 premature deaths a year in the United States. So, what is wildfire smoke and why is it a problem, especially for child health? Our team and many of our collaborators across the United States do a lot of research describing the effects of environmental chemicals in general on maternal and child health. And of chemical exposures, wildfire smoke is interesting and challenging to study because it's a highly complex and variable mixture of toxic substances. And that includes gases like carbon monoxide, but also suspended particles. Think of soot, for example, soot, which causes that characteristic dark color of wildfire smoke and causes dark skies. And sometimes here in the Pacific Northwest, for the sun even to be blocked out during wildfire smoke events. And we know that the composition of wildfire smoke, the chemical composition, the types of particles, it's strongly determined by what is being burned. And so traditionally, wildfires are forest fires, shown there on the left, and the material being burned is primarily organic materials, so wood and other plant matter. But increasingly common these days are fires that occur on what we call the wildland urban interface. And those involve fires that start in the wilderness at the border of cities and neighborhoods. But this leads to fires then that consume homes and other buildings, as shown on the right, and as we know happened in the 2025 Los Angeles fires. So when this happens, the fires are consuming plastics, electronics, and other materials that really affect the composition and the toxicity of the smoke that people are exposed to. For example, there can be a lot of heavy metals and other toxic compounds that are part of the smoke mixture. And then a side note, another factor affecting the public health impacts is that smoke travels through the atmosphere. Again, sometimes smoke plumes will travel hundreds of miles before they affect air quality where people live. And during that progression, the chemical composition of the smoke can also change. And so these are some of the factors we take into account when we think about how wildfire smoke can affect child health. That's the chemical perspective. What's interesting is wildfire smoke and other types of air pollution is dangerous because not just because of the chemicals, but because an issue that's more related to size. And so smoke consists of particles suspended in air. And some of these particles are big enough to see and settle out due to gravity. You can think about being next to a campfire and seeing the tiny pieces of soot that drift out from the fire and then settle on the ground near you. And these larger particles are actually of much lower concern because they can't easily get into your body. And so what we're very much concerned about, though, is that the smaller particles. And so this graphic here shows we classify particles based on size, and it's the PM 2.5, so particles of 2.5 microns and smaller, sometimes much, much smaller, that can cause really the most health damage. And so these particles are a big problem because when they're inhaled, and we're thinking about child's health, so think about a pregnant individual, an infant, or a child, when they inhale the smoke, the tiny particles and the toxic chemicals that are part of these particles travel through the respiratory tract and so far deep into the lungs that they can cause serious damage to the deepest and most vulnerable parts of your lungs. And then even more problematic is that the particles are small enough to travel beyond the lungs, so they get into your bloodstream, and then they can get to all of the organ systems, including the brain, plus the placenta and the developing fetus in the case that exposure is during pregnancy. And so for these reasons, The health impacts of wildfire smoke, I think, are surprisingly broad across all of the aspects of health. And so the health impacts can be short term. We know all of us who've experienced it. We get eye irritation, coughing, headaches, but there can also be long term persistent health effects, including on the nervous system. And so we've associated wildfire smoke with even neurological conditions for children, like increasing risk of ADHD and autism, as well as exacerbation of asthma. So, one more aspect that we've described in research that's important to this public health problem is that wildfire smoke, it's sort of an equal opportunity toxic chemical exposure in the sense that it affects even the most affluent communities in the US these days. We know that some families are at much higher risk when the smoke does roll in. And specifically for the same event in the same city, people in different households will have higher exposures. And so this can be due to financial barriers for purchasing supplies for exposure reduction. I'll talk a little bit more about that in a couple minutes. Um, Limited access in some communities to information about wildfire smoke or differences in housing quality. For example, we refer to some homes as being leaky in the sense that there's more infiltration of the outside air, and in this case, wildfire smoke for those types of homes, meaning that people inside are going to be more exposed, even if they stay indoors. In some homes, they lack the heating and ventilation systems with HEPA filters, high efficiency particle filtration, that can effectively clean the air. And then some families also face barriers to healthcare necessary to treat or recover from the impacts of wildfire smoke. And then some people are biologically more susceptible to the toxic effects of smoke. And in our case, we're focused on child health. And so what's relevant here is babies in utero, younger children, especially infants. They're in critical windows of organ development. And so they're more at risk of the toxic insults of wildfire smoke. Um, and so the good news is that there's several ways, very effective methods to protect yourself and your children from wildfire smoke. And I think nowadays we're familiar with a lot of the common guidance that's given out by public health agencies during wildfire smoke events. For example, we're told to stay indoors where the air is usually cleaner than it is outdoors. But that means that we need to work hard to keep the air inside our homes as clean as possible. And that means often sealing up the doors and the windows, running the AC, especially if you have a HEPA filter on your AC unit, and also using portable HEPA air cleaners that can be put in rooms of your house. N95 masks very effectively filter out wildfire smoke. Surgical masks and cloth masks really don't do a very good job. Fortunately, young children under 7 don't necessarily fit into N95 masks. We can evacuate, leave the area for areas with cleaner air. And then everyone nowadays has pretty easy access to data on air quality, such as the current air quality index, the AQI. And we recommend that people use this data to inform your activities of yourself, whether to cancel your child's soccer practice, for example, to avoid their exposure outside. And then lastly, you can talk with your healthcare provider about your kids' health. This is especially important for children who have asthma and thinking about preparations before the upcoming wildfire smoke season, including having medications on hand and a plan to modify behaviors when there's smoke events. So the good news is these methods exist, but we know that not everyone has access to the resources and information needed to take protective actions for themselves and their children. And so this is the transition to our team's recent research, which is focused on developing programs that can support parents and pregnant women during dangerous smoke events, and especially in vulnerable communities, which are those in remote regions, communities that are under-resourced, where we know that children are more at risk of wildfire smoke. So, in other words, all this research tells us that wildfire smoke is dangerous and that children are at risk and that we know that there's ways to reduce exposure. But we know surprisingly little about the real world experiences of families across the US when smoke is impacting their neighborhoods. And this is an important knowledge gap that's limiting our ability to develop programs that are effective. And so, in multiple current studies, including the one that we're going to focus on in a couple minutes, we're working to understand first what actions parents are currently taking. In recent wildfire smokes, did they take any of these protective actions that I just described? And then, more importantly, what are the factors that drive these behaviors? For example, is it knowledge about wildfire smoke health risks, knowledge about how to use an air cleaner? Or maybe it's you've had negative experiences in past smoke events, and that's something that motivates your behavior in future smoke events. And what's the role of, for example, family income and access to resources? So, what are the factors that motivate behaviors or enable behaviors? And then what are the barriers also to taking more actions? Because if we can describe these things, then we can develop more effective programs that will support communities in future wildfire smoke events. So that's the backdrop, and this transitions to. I'm happy to hand over to Javier, who I've had the pleasure of working with for the past couple years, and he's going to tell us about a study that we did last year in the Yakima Valley. And this is a community that has expressed high concerns about wildfire smoke and child health. And he's going to start by describing the region, the community, the issues that they face, and then he'll talk about this research that we've conducted.
Yes, thank you, Christine. I'll load up the next slide deck here in a second. But thank you for that introduction on setting up the background of this important work. I'm going to load up the slides now. All right, well, hopefully you all are able to see the slides. But if you have any issues, please let us know in the comments. Okay, thank you, Emily, for confirming that. Yes, my name is Javier Silva. I'm a second-year PhD student at the University of Washington in the Department of Epidemiology. I've been very fortunate to be around the UW now since 2018 when I started my undergraduate studies. A lot of my work has focused on child maternal health. Was involved in a few projects during undergrad and also did my master's thesis within that topic. And have been very fortunate to be involved in some of this work with Christine's team as well. But yeah, thank you all for joining us, and very privileged to share the space with all of you, and look forward to sharing a little bit more about this work now. All right, so I want to start off by saying that I was born and raised in the Yakima Valley, specifically in Titan, which is a small town in the Upper Valley in Yakima. My parents are agricultural workers who have labored in both farm work and also in tree fruit packing warehouses. My grandfather was the first to arrive in Washington as part of the Bracero program a couple of years ago now. And he later brought my dad over, and they've all been working in agriculture, myself included. When I was in high school during the summer, did some work in agriculture as well. So the exposure to wildfire smoke has been pretty prevalent for myself and also my family and my community. And this is very important work for me. Yeah. So the Yakima Valley is known to have desert-like weather. Winters are very gloomy and cold in this area, and summers come with beautiful hot days and lots of sunlight. However, these beautiful and warm summers have come with some tabs. So as Christine has already described, over the last decade, every summer comes with wildfires in the surrounding areas of the Yakima Valley. During the months of July through September is when peak wildfire smoke season comes. And given this area is a valley, the smoke from nearby fires settles among the community, and it's at ground level for most of the part. These constant events of wildfire significantly harm air quality and pose health risks to the community. Existing air quality issues, in part caused by the prevalent agricultural burning practices that are in the area, contribute to the concentration of air pollution near ground level. And adding in the additional burden of wildfire smoke in the area has led to levels of outdoor PM 2.5 or particulate matter, which Christine described earlier, in the county to be up among the highest in the US. And recent estimates indicate that Yakima County PM 2.5 levels is about 50% higher than the nationwide county average. Um, some additional information about this area is that the region is home to a diverse population with a high proportion of Spanish speakers. More than 40% of Yakima County residents identify as Hispanic or Latino, and this proportion is higher in the Yakima Valley. Some Spanish-speaking residents experience linguistic isolation, which can impact a family's ability to access and comprehend health-related information, which includes public health communications related to wildfire smoke exposure. So we saw a little bit of the gaps with communicating information during the recent event with COVID a couple of years now. This is something important to highlight. And the Yakima Valley has a significant number of first-generation immigrants, many of whom originate from Mexico and are employed in the agricultural industry. These individuals face unique challenges related to health literacy, as well as ability to take preventative measures due to language barriers, limited access to healthcare, and financial constraints. There's also a high burden of chronic diseases in the region, contributing to increased vulnerability to wildfire smoke exposure. So one example is that adults in the lower Yakima Valley have approximately 50% higher rates of obesity, diabetes, and high blood pressure compared to Washington State. And again, the Yakima Valley is also unique in its heavy reliance on agriculture. According to the Employment Security Department, there was over 29,000 jobs, resulting in 1.16 billion in wages in the area. With this comes a large number of agricultural workers who are directly impacted by a combination of wildfire smoke exposure and also extreme heat during peak harvest times. Most agricultural workers work outdoors and have little control over their working hours and days because they must work when the crops are ready to harvest. So there's not a lot of flexibility in terms of when they are able to work. And another thing to know, with agriculture, it is pretty low paid. And a lot of these workers are not able to afford to miss a day because of their wildfire smoke outside, because that can mean that they won't be able to have enough to pay a certain bill. So those are key things to consider. So this combined health implications of both heat stress and smoke exposure are substantial. According to the Pacific Northwest Agriculture Safety and Health Center at UW, heat strain can lead to severe heat-related illness and death, as well as traumatic injuries and acute kidney injuries. And exposure to wildfire smoke itself has been associated with respiratory conditions and can exacerbate underlying asthma and chronic obstructive pulmonary disease, or COPD. So with all this in mind, again, just setting up the tone as to why this type of work is important in the area. In 2024, almost a couple of years ago, we conducted a study on wildfire smoke in the Yakima Valley with the hopes of guiding future public health action, including new programs or resources for the community that would help the community in taking protective actions and ultimately improve child health within the community. So we had two aims, as you can see described on this slide. The first aim or objective of this project was to learn about families' experiences and unmet needs for protecting their children. We really wanted to understand what are they currently doing to reduce wildfire smoke exposure. We wanted to learn more about that context in terms of what are families currently doing and what can we identify that we can strengthen. So we also asked about what barriers they are facing to implementing any of those protective actions, and also what are facilitators, what motivates the community to take part of protective actions in their daily lives. A second objective that we had as part of this project is we wanted to have a little bit more of an impact in the community by involving the community, interacting and conducting and translating the research that we were going to conduct. So in addressing this objective, we partnered with a local university. So as outside researchers from a large research university here in Seattle, it was really important for us to work closely with community members so the project would effectively capture local perspectives, but also to increase the ways we can essentially provide additional support for the community and not only come up, take your data, and that's it, right? So we really were intentional about creating those relationships with the community and working together and assessing what truly matters to them and how we could support in advancing the type of support that the community receives. So we did two things to bridge this gap here. The first was to partner with Heritage University, which is a Hispanic and Native serving institution and located in Toppenish within the Yakima Valley. And one thing to know about this community is that 75% of students at Heritage University are first-gen college students, and most of them grew up in the Valley. We hired Heritage undergrads as interns to work with us as research assistants. We provided training for them on epidemiologic methods and provided career building research experiences. I myself am from the community, again, as I mentioned earlier, and although I have been at the UW for a few years now, my roots are deep in the Yakima Valley community, and I think this really helped with the smooth partnership and connection with undergraduate students at HU. I truly saw myself in those students, and it was very fulfilling to see their growth as we guided them through some of them their first research experience. And some of that more on the ground work with data collection and working with the community members themselves. So we also, in addition to this partnership with Heritage University and partnership with the students, we also assembled a community advisory board, including parents, educators, community organizers, and other members of the community to give us feedback on both study protocols, research findings. And I think this was really important just to ensure that we're highlighting what are the pressing concerns and what the interests of the community are in terms of what work they want to do within their community. So this was also an important aspect of the development of this project. All right, so I'm going to describe a little bit about the data collection that we did as part of this project. So to answer our research questions, we developed a survey to collect information about parents' experiences with wildfire smoke and the factors that motivate their protective actions. We administered the survey online and in person at community events. And the most successful data collection was in person. The students helped us choose the best venues, including programs for distribution of free and reduced price lunches over the summer, food banks, and health fairs. So one keynote to mention here, again, within the community, a lot of the communities of low income, and these summer meal programs within local high schools or middle schools in the area were very popular, and these were key sites for us to be able to effectively collect data in the time that we had to collect all of these surveys. We additionally partnered with community food banks, and again, just to highlight uh, the setting of this community of really needing that additional the use of local community resources. I want to mention like my family themselves, they are still current users of community food banks in the area. And this just essentially highlights like the need for resources, but also the use of resources when they are available to the community. And I do want to mention another thing for the data collection aspect. We were able to begin data collection on the last week of July of 2024, and we concluded data collection in September, mid-September of that same year. So it was about a month and a half or 2 months, and that we were really full hands-on in terms of data collection, and all of this was driven with the input of the students and their enthusiasm in wanting to be part of this project. So I do want to highlight that that was very successful and part of the support from the students. So as you can see here, we were able to collect 199 total participant surveys in that month and a half or 2 months that we had for data collection. And most of the participants who did respond to these surveys were female and identified as Hispanic or Latino, as you can see on this slide. And about half of participants were born in Mexico. Most had a household income below $40,000 a year, and a lot of parents had jobs in agriculture that required them to work outdoors in wildfire smoke seasons. So you can see some of the main descriptive points here on this slide. And again, just to reiterate the importance of partnering with local community organizations to be able to conduct this work. As you can see, a good amount of this population was earning a pretty low income for their families, with about 60% of them earning below $40,000 a year. So from this data, we were able to identify that about 80% of parents expressed strong concerns about the smoke and the health of their children. And these parents also reported that in recent smoke events over the past 5 years, about 70% of children of those respondents experienced health problems due to smoke. 91% of them, of the adults and children, experienced at least one health symptom related to smoke. And also 60% of adult and children had daily life disruptions, which include either missing school, staying at home from work, and so on. So one thing we wanted to learn about was a parent's interest in specific programs or resources that might help them in the future. And with our community advisory board, we developed a list shown on this slide. And on the survey, we asked how likely they were to utilize these resources if available to them in the future. And the blue bar shows the percent reporting that they'd be highly likely to do so. The dark orange, likely, yellow is possible, green unlikely, and red very unlikely. So you can take a look at this slide. I highlighted the three at the top that were most popular, including technical and financial assistance and using an indoor air cleaner in their home, instructional videos shared on social media, and support in obtaining and wearing N95 masks. Some things that we also learned through just conversations on the spot during data collection is that the community was truly intentional about wanting to improve the ways that they can integrate protective actions for themselves and for their children. They expressed that they were aware about the potential impact of exposure to wildfire smoke. However, they just didn't know what they could do to mitigate the potential impacts that wildfire smoke could have on their families. So that was another thing that was learned from just conversation with participants. So here on the next two slides, we'll show some additional main findings. So on the survey, we asked participants how frequently they took these 6 actions during extreme smoke episodes. So staying indoors, checking air quality, wearing a mask, using an indoor air cleaner, talking to a healthcare provider, leave the area and travel to a place without smoke. And the most common action were to staying indoors more than usual, and many did consult the outdoor air quality and wear a mask at least a couple of times. But we also saw a lot of opportunities for increasing the frequency of actions, including using indoor air cleaners, which is a very effective way to keep the indoor air healthy. But some people reported not being able to afford these items. They also reported not knowing where they could potentially purchase these air cleaners or even how to install them. So these were some of the things that we did identify from those surveys. And finally, we wanted to know what motivated people to take action. So on this slide, we show essentially our overall goal was to determine the predictors of protective actions for the community, both the barriers and the facilitators. During the past smoke events in the Yakima Valley. So here in gray are the 11 factors we assessed. They included vulnerability measured as existing health conditions like asthma, perceived threat, perceived expense, whether the parents saw other community members taking action, a measure of social norms, knowledge, confidence, and past negative exposures in smoke events. And we estimated the associations of each of these with a total action scores. So we found that several factors highlighted here in blue were strongly associated with the total protective action score. Two of these in particular stood out to us as important for future public health programs. One is whether the community members were also taking action, the measure of social norms. Our team from the Yakima Valley observed that this has reflected very strong social cohesiveness in the community. So we hope to tap into this community strength in the future interventions we've developed, and we'll share a little bit about this towards the end of the presentation. And second of these findings is that more knowledge about wildfire smoke, but not just general knowledge about the danger of wildfire smoke and how and its health effects, but a little bit more intentional and practical knowledge, which can be targeted in interventions. So on this slide, I want to highlight the great work again that the student interns from Heritage University both had on this project, but also some of their successes along the way as being part of this project itself. So in addition to getting research experiences that they were able to use their survey data to conduct their own hypothesis testing and presented their findings at local and national research conferences during the year of 2024. And one of our students, Jerry, which is here on the right of this picture, um, won an award for the best presentation in public health at a national conference, and he went on to apply to graduate school programs. And just this month, he recently notified us that he's been accepted to a good handful of programs across the U.S. Some of the best programs in the country, and we're just very proud of the work that these students have been doing as part of this project. So just to highlight a couple of quotes from the students that they shared with us, Aliyah Villa, who is on the left in this picture, shared that it was a wonderful experience to work with a team that genuinely cared about the research and always had the community's best interest. And Jerry additionally added that through this opportunity, I learned that proximity builds trust and data drives action. He further shared that partnering directly with families in his community allowed him to understand how communities' voice through community organized forums and sustained outreach was intentional for the type of work that is done in the area. And you can also see here in the picture in the middle, it was Virginia Yelichin, who was our third research intern for this project. But I'll switch gears over back to Christine now for the rest of the presentation.
Thank you so much, Javier. I just have a couple slides to bring it all together. Let me see. So I will pop back in. Can someone let me know, is this proper sharing in terms of, can you see just my slide? Okay,
Yes,
great.
that looks good.
Thank you, Emily, Javier. And I do want to, but before I wrap things up, I want to thank Javier for describing this, and I really want to emphasize, because Javier is humble and won't state this, but his mentorship of the students. He drove from Seattle to Yakima several times that summer. He worked so closely with the students and the data collection and in preparing the research presentations. And that was very, very critical and key and meaningful for the students, everything that he did to support them. So I just want to highlight how important that was for the project. And so I'm just going to wrap up. We're near the end of the time. I want to bring it back around to, we conducted this study. Javier described our findings. And what do we do with this? Because what I said from the beginning is our goal is to apply these research findings to help families in the Yakima Valley and otherwise. And so we know that there's things families can do. We know that there's barriers. So how do we reduce the barriers to protective actions? And I just put at the bottom just the two main snapshots from the results Javier described that we're trying to use now for public health translation. And first, as he noted, there were several things that people were very interested in terms of future support. We're building those into future intervention, which I'll just highlight in a second. And then in the bottom right, again, what he just described is we found that there is a couple of very strong predictors of protective behaviors that we think can be modified and used in future interventions and programs. And so the slide is a little blurry, but so what we have drafted is a program that we're in the process of piloting and getting funding to hopefully do larger scale studies. We call this the Reducing Infant Smoke Exposure, the RISE intervention. And so, what we're trying to figure out is what if we can deliver an intervention package to do moms in the Yakima Valley? And to just briefly note the details, this would consist of delivery of supplies, especially an air cleaner with a HEPA filter, some N95 masks, complemented with education. And the education could be written materials, could be links to videos online, specifically instruction on how to use, set up and use the air cleaner, use the masks. And then I think one thing we've learned is important is also to do timely outreach to people when smoke is impacting their communities, to remind them of guidance and offer additional help by text message as needed. And so we're developing this protocol, and we'd like to ultimately evaluate, is it effective? And our goals would be to use this program to enable more protective behaviors, ultimately reduce infants' exposure to wildfire smoke, and improve infant airway health, of course, is the long-term goal. And so the last thing is, well, if we develop this intervention, how do we know if it's effective? And what we would do is, you might be familiar with the concept of a randomized control trial, which is often used in medical research. And we can do the same thing in environmental studies of impacts on children. And so what we would do is, and this is proposals that are being under review for grants. We'd recruit mothers receiving care at the Yakima Valley Farm Workers Clinic and randomize them into a treatment group and a control group. The treatment group would receive the intervention before wildfire smoke season, and the control group would receive it right after the right after the wildfire smoke season. And then we would track behaviors, exposure to smoke, and infant respiratory symptoms, and then compare these things between the two groups and determine whether the intervention was effective. So this is future work, directly extending from the project that Javier described that we were able to do with everyone in Heritage. And so just acknowledge, and this is just a small group of the people who made this possible, including my collaborators at University of Washington, several amazing faculty members at Heritage University who helped to recruit the students and to support them, the students themselves in the bottom row. And then Javier and Eileen was another graduate student at the University of Washington who was so key in helping us mentor the students. So yeah, that's everything. Thank you so much. We'd be very eager to hear feedback or ideas, perspectives from other people. All of you have probably had some wildfire smoke exposure of some sort. Yeah, and thank you so much for the opportunity to talk about our research.
Thank you both for sharing this presentation with us. I have to say I'm really amazed about the collaborativeness of it, and by including the community in the research as well, and supporting student work. So I know some of you probably have some questions and comments, but first I would just want to give people the opportunity who may have to leave a little early, a link to our session evaluation and the information to get their Medical Library Association CE. And even if you're not a member of MLA, you can still receive the certificate and the CE by completing the survey and answering that you want that CE credit, and more information will be provided. And let me see. Oh, one more thing. If you are a certified health education specialist, please complete the evaluation to register your attendance and to receive the certificate. And again, you will need your CHESS ID number to complete that evaluation. So we'll go ahead and take some questions and comments. And I just wanted to ask a question first while people are thinking and typing. You had mentioned a few times in your presentation that people had limited access to information, and you mentioned this toolkit and, trying to get the word out. And I was wondering, how can libraries and or other organizations help support that? Can they have programs with speakers? Can they have brochures or the toolkits available at their locations? Or is there something else that you would suggest?
Yeah, I think that's an excellent question, and I'll jump in, and then Javier, I think will definitely have a good perspective as well. One thing that we've found is it's access to materials like air cleaners, um, and so I think being able to disseminate both just information about the air cleaners, but what we've also found is what can be very powerful is demonstration of how the air cleaners work. And I have some colleagues at the University of Washington who have they have equipment that they can set up and bring out into the community where they kind of simulate a wildfire smoke exposure in a closed environment and have air pollution monitors in, for example, a closed classroom and a HEPA air cleaner, and even can kind of demonstrate the effectiveness of the air cleaner in reducing the concentration of the air pollution in the room with operation of the air cleaner. And so, yeah, I think libraries could be pretty, I think, convenient opportunities even to do those types of demonstrations. We found that things like that really help everyone, I think, just really understand in concrete terms how effective these air cleaners can be in reducing wildfire smoke with um, tangible evidence. So, yeah, I think that's one way. Javier, thoughts on that, especially on of thinking about Yakima or other areas about how libraries can help.
Yes, absolutely. That's a great suggestion, Christine. And something that I'm also thinking about is the potential, I don't know, up to what bandwidth the libraries may have to like reach out to community members, right? So I think one of the successes of this project was really the building the trust aspect, and not only building the trust, but use that leverage of where does a community receive their resources and support. Like I mentioned, like for us, partnering with like local food banks, local schools, and just local community hubs made it very an efficient way for us to be able to work with the community closely. So uh, my suggestion would be to potentially do some outreach, because the community is very interested in making use of the resources that are available to them. They, through the conversations that we had during the data collection, they were very intentional about wanting to learn more about what opportunities they had to learn more about how they can protect themselves from wildfire smoke, for example, in our focus. So I think just the outreach part is maybe where I would add a little bit of emphasis, because community members are eager to make use of any resources and opportunities that are available to them to be able to improve their health or lower the exposures that they have. So and I think, again, an effective way that we can do that is potentially partnering with those local community organizations, and ask like, how can we best support you all in disseminating this information to the community? So that's what I would suggest a good start it could be as well.
Thanks, Javier. And actually, Carolyn, I'm going to jump in too because I remembered one other thing and something I didn't talk about during our talk, which is another way that public health practitioners support communities is by setting up, we call them clean air shelters, which are just community spaces where there's cleaner air. And in places like the Yakima Valley, Javier mentioned the combined risks of heat and wildfire smoke, which can be particularly harmful. So places that have both clean and cool air when there's a wildfire smoke event during extreme heat periods. And so I think libraries can function as that as well, often in many places. And so, yeah, that's another concrete way that I think libraries can support. I forgot to mention clean air shelters during our talk, but that is another resource.
Thank you. That sounds great. Thank you for sharing that. Emily, are there some questions in the chat that we should go over?
I don't see any questions in the chat, but I have a question. Well, Javier, while you were talking about your interns, I don't know if I've ever seen so many heart emojis in an NNLM webinar. So I know that this audience has a soft spot for your interns, and I'm wondering if you could talk about how you made that connection with Heritage University and how those students were recruited to participate.
Absolutely. Thank you, Emily, for that question. I mean, I want to note that I think this collaboration has been something that has been going on for years through Christine's group. Before I came on to Christine's work, they already had that connection with Heritage University and with some of the faculty there. So I think the credit goes to them for establishing that long-term connection and collaboration with the students or with the institution itself. However, once we had the students themselves, I think are students in the community are very eager to make use of any opportunity that they are given, and they truly are inspired to learn about really as from as many people as they can. And I think their enthusiasm and wanting to do work that is important to them and in the community just leveraged how work they worked with us and how hard they worked with us. Um, and yeah, I think what also helped myself in being able to work with the students is that I could see myself in them, and I think for the most part they could see themselves in me as well. I think we all grew up in the valley. We knew the struggles that our communities face. We all came from farm agricultural or farm working backgrounds from our parents, and we knew the struggles in our communities. We knew the struggles of like being a first gen student in here in the U.S. However, that also built strength, and there was strength in that little community that we were able to build, and I think that was essential in both the students being comfortable and being in an environment that they can flourish. Um, so yeah.
And I'll add to everything that Javier said. And Emily, thanks for asking about this because I think the community engagement part was really the best part of this project. So Javier mentioned that we had a longer standing relationship with Heritage University. But I do want to emphasize we had worked with Heritage in the past, but this was much more, I think, effective. And I want to make sure Javier knows like how critical he was to really making this. I mean, his mentorship, and that was different in this project than in our prior collaborations with Heritage. I think having Javier as a mentor for the students was incredible. And everything he's talked about, having the personal experience and being able to come to the University of Washington and pursue research. His mentorship was super valuable. And I also want to just give a shout out to the faculty members at Heritage. They have a long-standing history of supporting research opportunities for especially undergraduates from underrepresented groups. And so their work was very important. I feel like those of us at UW, me, for example, I was only bringing the research experience, and it was everyone at Heritage and Javier who were able to make this happen, to make this a very valuable research product in terms of the data, but then also the experience for the interns. And I feel very lucky to have been able to work with them in this way. And I hope we can replicate this both at Heritage as well as at other local universities and colleges around the US, because I think there's a lot of smaller educational institutions that don't have the resources that we have at the University of Washington. And to be able to help them set up research experiences that are involve real data. And also we have a manuscript under review that the students are co-authors on. And so to be able to bring like those very valuable research experiences to these smaller colleges and universities, I'd like to help continue supporting that in the future.
Thank you for saying that, Christine. I think that is so lovely to hear that you're taking into consideration other universities and other places that may not have the resources and the great support of of students as well as the community itself. I think that's really wonderful. I do want to say that in the chat, there have been many comments about how wonderful the presentation has been, and so just there haven't been many questions, but they really appreciate the information and learning more about this. I'm going to also go on to the next slide and just let you know that our next session will be March 18th with the Pediatric Pandemic Network and Resource Central. It's titled Advancing Disaster Preparedness and Everyday Readiness, and you can register to attend and you can share this information with others. You can visit this website, the link there, and see our past recordings of past sessions and to register for upcoming session as they are available. It may be a few days before the recording for this session is available, so we appreciate your patience during that wait time. And we want to again thank you, Dr. Loftus and Javier. We really, really appreciate learning more about this research, and I am excited to hear more about this as you continue working on it and all your strategies to support the various communities. So thank you all again. We appreciate you being here and taking time out of your busy days to attend, and we hope to all see you at the next session. Thank you.
Thank you so much.